Medicine, and we're really happy that you could join us on this Saturday afternoon for this Lifestyle Med live event. We'll be talking about obviously a very important and timely topic. So before we get there, let's just want to say a word about our partners for this event. Oh yeah, before we get to that, please again note that we are live streaming on Facebook, and we're also recording this session as well. So please do take note of that. So again, the main partner for this event is Lifestyles Medicine. We're a not-for-profit, and we basically put on community health programs to help people learn about the principles of lifestyle medicine so they can prevent and reverse chronic disease. So if you want to learn more about us and upcoming programs, please do check us out at lifestylemed.org. We're also proud to partner with Paradise Fields. Paradise Fields is a certified organic farm and clinic in the Hamilton area, and their mission is to produce the most nutrient-dense produce and to help others reverse chronic disease using the power of food as medicine. So it's a very beautiful place. So if you're in the GTHA, if you want to check them out, we invite you to do so. You can go to paradisefields.ca. Our clinic partner is Pathways Lifestyle Medicine Clinics. They have 3 locations in Toronto, and they're a naturopathic clinic that focuses on helping people treat and reverse chronic diseases using evidence-based lifestyle medicine. So again, 3 locations. They're all there. They're on the screen. If you want to learn more or book an appointment, go to pathwaystoWholeness.ca or call the number there on the screen. Lastly, this event is really being co-hosted with Downsview Seventh-day Adventist Church. I think many of us here are Seventh-day Adventists, but those, if you are not, please welcome. Thank you so much. Adventists are one of the most widely researched people groups in the world. If you go to PubMed and search up Adventists, you'll see hundreds of studies about Seventh-day Adventists. They're known to be one of the longest living people, and they're unique in that they, among Christian denominations, they promote a plant-based diet and other healthy living practices. So I'm going to just turn it over to Sherelle Smith from the Downsview Seventh-day Adventist Church, who's going to just share a few welcoming words. So Sherelle, you there?
Okay. Thank you, Daniel. I just want to say a big welcome to all of you, and for those that are joining us from Downsview Church, want to welcome you. I know that there is a lot in store, and we're going to learn a lot. We're going to have a good time this evening. Thank you for jumping on, and remember to have your friends jump on too, because there's a lot of information that we're going to learn, and we don't want anyone at all to miss it. So all of you that are on, please tell a friend, tell your neighbor, tell someone, tell them to jump on, send them the link so we can have a wonderful time. All right, we're going to say a prayer to begin. All right, let us pray. Our Father who art in heaven, we thank you for your goodness towards us, for your love and your mercy. We thank you for all the information that you have allowed for us to be privy to, so we can learn and we can understand more about our bodies, the great plan you have for our bodies, and how you are able to help our bodies to heal with the right lifestyle change. Father, as we listen, we pray that you will help, that we won't be reluctant, but we will do so with a willing heart. We'll be ready to change our lifestyle and give us understanding of what is said and help us to learn a lot. Thank you. We pray for Christ's sake. Amen.
All right. Thank you, Sherelle, so much. Again, thank you to Downsview Church for partnering and sponsoring this event with us. All right, so let's dive in here. Our topic is called Should Youth Get It? And as you see on the screen, as probably why you're here, we're going to talk about a really important topic. As you know, COVID vaccines continue to be rolled out, and there's now a lot of conversation and debate about vaccinations for young people now. And you may have seen some headlines about studies on the Pfizer vaccine saying it's 100% efficacy. But what we really want to do today is we're going to have Dr. George Cho share with us and go through the actual published study. because how the media portrays these studies may not be exactly what it really purports to be. So he's going to go through the study with us and then share with us what this means from a lifestyle medicine perspective. Um, so Dr. Cho, thank you so much for joining us here. Dr. Cho is the clinic director and naturopathic doctor at Pathways Lifestyle Medicine Clinics and at Paradise Fields. And he focuses his practice on science-based lifestyle medicine for prevention, treatment, and reversal of chronic diseases. So Dr. Cho, again, thank you so much. I'm going to turn it over to you. And after his presentation, which will go for maybe around like 40, 45 minutes or so, we want to get to your questions. So as you hear the presentation, if you have questions, put it into the chat box and we'll try to get to as many as possible afterwards. If you are listening on Facebook, welcome. And again, put your questions in the comments and we'll address those as well. All right, Dr. Cho, over to you. Thank you.
All right, everyone. Welcome to all of you for this important discussion today. Just first, I want to just make it clear that this is for educational purposes only. Your doctor and your child's doctor knows best about your child, not me. So it's best to get this information and then have a discussion with your healthcare provider. My goal today is very simple, is to provide you with the data and a perspective, a lifestyle medicine perspective to vaccinating children and young people. All right. So my goal today is not to tell you to get your teen vaccinated or to not get vaccinated. Is to give you the data that you need directly from the study, and to give you some perspective, like a lifestyle medicine perspective. Okay, so that's my goal today. All right. So if you are pro-vaccination or anti-vaccination, sometimes you come into a presentation hoping that the presenter will validate your point of view, but I think we can just try to present the data today. All right, our goal is not to really try to be biased towards one way or the other, at least as much as possible. Okay. All right, so this is the actual study on the Pfizer vaccine for teens. It's published in the New England Journal of Medicine, one of the most prestigious medical journals in the world. This is the actual study here. Okay, it was published not too long ago, probably like less than a week ago. Okay, and so what we're gonna do is we're gonna bypass the media, we're gonna bypass the pro-vaxxers, the anti-vaxxers. We're gonna just look really directly at the study itself and ask ourselves, what did the study actually find? I think this is really important to do because this is where we get the data from, right? So the media has their spin and the other group has their spin as well. We want to look directly at the study and see, okay, what did they find? I want to point out that the vaccines right now are approved for I believe it's 12 and older, and this study was directly looking at those who are 12 to 15 years old, right? Before we do that, let's look at the vaccine itself. Okay, so what is the vaccine? Okay, so the Pfizer vaccine is an mRNA vaccine. It's a messenger RNA vaccine. Messenger RNA is code. It's genetic code, all right? So if you remember way back in high school, messenger RNA is a transcript from DNA, okay? And DNA becomes messenger RNA, so there's a copy that's called messenger RNA. It leaves the nucleus, and what the body does with the mRNA is that it makes protein. So the messenger RNA is code for your body to make certain proteins. Okay. So the question is, what protein is this messenger RNA vaccine making your cells produce? Okay, well, this is the coronavirus, the SARS-CoV-2 virus, okay, right here. And you see on the outside is this spike protein. Okay, you see the little spikes coming out? That's called the S protein, the spike protein. your body in many organs and cells has these receptors called ACE receptors, okay, angiotensin converting enzyme 2 receptors. Now, what the virus does is it uses the spike protein to connect with the receptor, and when it does that, it allows the virus to enter your body. You guys see that? When the spike protein connects, the virus is able to enter your cells, okay? So basically, what the messenger RNA virus does is that it makes your body cells produce this spike protein. Okay, so the messenger RNA is code for your body to start producing this spike protein. So why would they do that? Okay, well, we'll get to that. Okay. Now, just a little bit about what ingredients are in the vaccine, because I think a lot of people are interested in that. So you have the genetic code, right? The mRNA. You have a lipid coating. Okay. Then you have a lot of other non-medicinal ingredients. You know, you have buffers and salts. All right, and basically these are there to stabilize the mRNA, okay, the vaccine itself. Okay, there's no preservatives in the vaccine, and you notice there's no like heavy metals and things like that. Okay, so it's pretty nothing too startling here in my personal view. Okay, all right. So first thing you have to understand is that your teenager is not being injected with the virus. Okay, the vaccine does not contain the coronavirus. Okay, it contains the mRNA. It contains the messenger RNA. Okay, not the virus. Okay, that's something that's important to keep in mind. All right, so what happens? Well, your teenager gets injected with the COVID vaccine, the mRNA. The mRNA enters your cell. You see that here? This is your cell. The genetic code enters your cell. This is your nucleus and this is your DNA. Okay. The mRNA does not need to enter your DNA. There's some people who are concerned that the messenger RNA is going to change your DNA. It really doesn't do that. Okay. It doesn't enter where the DNA is. Okay. Of course, this is the code, right? So it starts to code for the spike protein that we talked about. So the vaccine makes your body cells create spike protein, and then the spike protein expresses itself on the outside. Okay. Now, the point of that is that so that your immune cells, your body's immune system, detects the spike protein, because the spike protein is not supposed to be there. So your immune system detects it as an enemy and starts mounting an attack on the spike protein. Okay. And then the end goal is obviously to create antibodies. I hope that makes sense. I hope I didn't go too fast. Okay, so the genetic code, the mRNA, makes your body cells produce spike protein. Okay, and your body mounts an immune response, and hopefully you end up creating antibodies to the spike protein. Okay, that's important because when you actually face the real virus, you already have the antibodies to the spike protein. So you see that this is the actual virus. So when you have antibodies already there, then it can neutralize the spike protein so that it can't enter your cell. Okay. And also your immune memory allow you to mount a quicker and more stronger response to the actual virus. Okay. So this is the end goal of the vaccine. Okay. So just to recap, you got the vaccine, the RNA. It makes your body cells produce spike protein. Okay. Your B cells are going to then create antibodies so that when you actually face the real virus, you have antibodies there to neutralize the spike protein. Okay. You also hopefully you could get your T cells and so forth trained so that when you face the real virus, that there'll be a quicker, more stronger response to it when you actually face the real virus. Okay, so that is what the vaccine does. All right. Now, there is a concern that that your body cells will produce spike protein like forever. Your body will become a spike protein producing machine, And so this will lead to autoimmune diseases, right? But that's actually likely not true because the RNA is quite unstable. Okay, so this RNA here, what the part of the vaccine, it is not like it lasts in your body forever and ever. Okay, it's quite unstable. Okay, it's gonna go away. So it's not like your body's gonna produce spike protein forever and ever until you die. Okay, so I think that's another thing that's important to keep in mind as well. I'm not saying that there can't be other autoimmune diseases in the future from some other mechanism, but when it comes to the RNA itself, it's very unstable. Okay, so it's not there forever and ever, making you produce spike protein forever and ever. Okay. All right, so let's look at the study itself. What did they find? Okay, the Pfizer study. Okay, in the when the study was produced or published, or when they did the study, the Pfizer, the company, they released a press release statement, and it said, in a phase 3 trial in adolescents 12 to 15 years of age with or without prior evidence of SARS-CoV-2 infection, the Pfizer COVID-19 vaccine demonstrated 100% efficacy and robust antibody responses. So basically they're saying, we found in our study 100% efficacy. Okay. So let's look at that and see, what does that actually mean? Okay. What does that actually mean? What does 100% effectiveness actually mean when you look at the actual study? All right. So the study design will look something like this. Okay. About 1,100 people in each group, 1,100 kids, teenagers vaccinated, about 1,100 placebo, okay, not vaccinated. Okay, they got their first dose, then about 21 days later, they got their second dose, okay, and then they tracked them after that, okay. They looked at, were there any cases of coronavirus, of COVID, up to 2 months after the second dose. Also, during the whole study period, they're looking at safety. Was there any adverse reactions? Okay, symptoms, side effects. Okay, so very simple design. First dose, 21 days later, second dose, track them for 2 months. Were there any cases of COVID, and was there any safety concerns that arose? Okay. All right, so let's look at first, what's the safety data that they found? Okay. They're looking at two things when it comes to safety. They're looking at any short-term reactions after each vaccination. Okay, so after the first dose, within 7 days, were there any adverse reactions, any symptoms? Okay, after the first and the second dose. Okay. They also looked at through the whole study period, were there other adverse reactions? Okay, so let's look at what they found. In terms of short-term reactions, okay, basically almost all the kids got some type of adverse reaction. Okay, so you see your pain at injection site, 90% of the kids. The teenagers got pain at the injection site, fatigue, headache, chills, muscle pain. So if you decide to get your teenager vaccinated, you should expect that there's gonna be some level of symptoms, adverse reactions within 7 days of getting the vaccine, okay? And it's muscle pain, headache, fatigue, pain at the site of injection, chills, okay? And then there might be fever and other things as well. Most of these were pretty much mild or moderate, all right? And nobody died within the 7 days. Okay, so these are generally mild to moderate adverse reactions, okay? So as I read the study, my understanding is that within 7 days that this vaccine is generally safe, okay, within 7 days of getting the vaccine, okay, generally speaking, all right? Now let's look at this. How about during the whole course of the study? Were there any adverse reactions, and what were they? Okay. There was one boy, 14 years of age, who had a very high fever. Okay, and this occurred one day after getting the vaccine, and it resolved in 2 days. So he got like this very high fever, but then after 2 days it went away. Okay. There's also people who got what is called lymphadenopathy. Okay, so lymphadenopathy basically means swelling of your lymph nodes. Okay, so it looks something like this. Okay, so this is what it is. Okay, and 9 people in the vaccine group and 2 people in the placebo group presented with lymphadenopathy. None of them were severe. Okay, so it was just a mild to moderate presentation. Lymphadenopathy will usually go away, okay, in this type of situation. Okay, 6% of the group got unsolicited adverse reactions, okay, and most of them were basically mild to moderate in severity. Okay, so local and systemic events were generally mild to moderate in severity and typically resolved within 1 or 2 days. Okay. Now, there were some serious adverse events. Okay, so 4 teenagers in the vaccine group got a serious adverse event. 2 people in the placebo group. Okay, and my apologies, I wasn't able to really find out what exactly they experienced. Okay, but in any case, 4 and 2. Okay, so these were what they call serious adverse events. All right. So could there be serious adverse events? It does seem so. Was it directly linked with the vaccine? They're not exactly sure, but these events did occur. Okay, so are serious events possible? Yes, but it is also important to note that it's a very small percentage of the actual study group. All right. Now they also looked at adverse events of special interest. Okay, so they report in the study no cases of Bell's palsy, no cases of myocarditis, thrombocytopenia, or deep vein thrombosis. Okay, were reported. No case of anaphylaxis reactions to the vaccine were reported in the study. Okay, so this is what they found in their study. Okay, all right. How about deaths? There were no deaths. Okay, there were no deaths in the study. Okay. All right, and in the study, they say that phase 3 study is ongoing and will continue to collect information on the long-term safety and efficacy of the vaccine. Okay, so they did their study and they're continuing to track these individuals. They're going to continue tracking these people to see what happens. Okay, so as I read the study, my conclusion is that in terms of short-term reactions, the vaccine is generally safe. And within the study period, it does seem like, and when it comes to adverse reactions, there's a general level of safety. Okay, so there seems to be some risk of serious adverse events. It does seem to be a very small proportion of the study group. So generally speaking, it seems like it is safe within the study period. Okay. All right. Hold on a second here. Okay. Okay. So the question is this does this mean that the vaccine is 100% totally safe? Okay. In the study itself, okay, this is the researchers of the Pfizer vaccine itself themselves, they wrote in the paper, data on long-term safety and the duration of efficacy and antibody responses in children are not yet available. So this is directly quoting from the study. So basically, when it comes to within 2 months of the study, it does seem, we have to admit, that it does seem that it's generally safe. But beyond 2 months, they're saying that longer term safety data is not yet available. Okay, so this is the researchers themselves basically admitting to this. Okay, so that longer term studies, longer term safety, they're not exactly sure. It's not available yet. Okay. All right. Now, some of you probably heard about the cases of heart inflammation happening among particularly male teenagers aged 16 to 24. So this is the New York Times. As you can see, this is not a conspiracy website, right? This is the New York Times. They even reported of cases of teenagers, particularly males, getting a heart condition called myocarditis after receiving the Pfizer vaccine. All right, and it was serious enough that news outlets were reporting on this. Myocarditis is basically heart inflammation, okay, of the muscle. Right, so you see here the heart, and this is the muscle here, and it's myocarditis is inflammation of that muscle. All right. Now, the Israeli Ministry of Health released a report just a few days ago because in Israel, they were seeing this amongst the young male population, among 16 to 24-year-olds. There was enough cases for the Israeli Ministry of Health to look into this, and they released their findings, their conclusions, just like a few days ago. And this is what they found. Okay, they say there is a probable link between receiving the second dose of Pfizer vaccine and the appearance of myocarditis among men aged 16 to 30. Okay, these findings raise the likelihood of a causal link between the vaccine and myocarditis. So the conclusion of the Israeli Ministry of Health was that it does seem like there could be a causal link between the second dose of Pfizer and myocarditis, heart inflammation, heart muscle inflammation among young males. All right. So they're not saying it's a definite 100% link, but they're saying it looks like it's very probable. Okay. Now, the ratio or like the percentage is about 1 out of every 5,000 young men. So we have to acknowledge that the risk is there. Okay, the risk of myocarditis among young males is there. Okay, but it is also, we have to also acknowledge that seems like it's a small proportion of the population of the males. Okay, about 1 in 5,000. Okay, so that's something that I think it's important for everyone to be aware of. Okay, all right. If just for your information, symptoms of myocarditis is fever, fainting, breathing difficulties, rapid breathing, abnormal heart rhythms. Okay, in children. Okay, so if you do end up deciding to get your teenager vaccinated and they start experiencing these symptoms, then you should be kind of aware of the risk of myocarditis, especially if it's a male teenager. Okay, and there are potential long-term complications as well: heart failure, heart attack, stroke, sudden cardiac death. So myocarditis is a potentially serious condition that needs to be treated. All right, so it seems like it's a rare complication, it's a rare adverse side effect or reaction to the Pfizer vaccine, but it is there nevertheless. Okay. So is the vaccine safe for young people? Well, within 2 months, I think it is safe to say that this vaccine is generally safe. Okay. Beyond, so like longer term, the data we still need more data on that. Okay. All right. So, there's a group of people who say, this vaccine is not safe, period. Okay. And I don't think that's a really accurate way to put it. Okay. Because there is, they've done the study and there is a level of general safety associated with this vaccine. Okay. So to say that like this is totally not safe, I think is not an accurate statement to make. Okay. On the other hand, there's people who say that, this vaccine is totally safe. This vaccine is like if you're worried about the safety, then you're kind of crazy. But I don't think that's really accurate either, because the study researchers themselves, they say that they have no long-term data, and there's stuff starting to come out about potential risks with the vaccine, even among young people. So I think both sides needs to be kind of more nuanced in what they say about the vaccine. All right. So you as citizens, as people, try to make decisions for yourself and for your children. It's important to be aware of a balanced approach. There's general level of safety, but there's also some risk as well, albeit the risk is low. But it is still there, right? The risk is still there. Okay, and there is risk safety data that we do not know yet. Okay, so this is the truth. All right, now let's look at how effective is the vaccine. Okay, this is CTV News, and when they did the study, the CTV News reported it like this: conducted in the United States, the trial found the vaccine to be 100% effective in children aged 12 to 15. Okay. So they say, when it's 100% effective, and this is what the media is reporting, that the vaccine is 100% effective. Well, you know, when just a general, like a lay person, when they hear 100% effective, what comes to their mind? How do they interpret it? Well, just a lay person is going to interpret that to mean that the vaccine helped prevent infections, that the vaccine helped decrease symptoms, the vaccine helped decrease severity, the vaccine helped decrease transmission, and it was shown to save lives. When you hear 100% effective, the impression that it gives off is that those who were not vaccinated were probably getting really sick. Tons of them were going to the hospital, and maybe some of them were even dying, right? That's the impression that you get when you hear 100% effective, okay? But is that really what they found in the study? Okay, well, let's take a look, all right? What were they actually looking at in the study? It's important for people to realize they're looking at two main things. Symptomatic COVID-19, meaning did people get symptoms and then test positive for COVID-19? Okay, so like, you know, cough, fever, chills, that type of thing, okay? And the other thing they're looking at was severe COVID-19, you know, like going to the hospital, you know, difficulty breathing to the point where you need to go to ICU and death, right? So it's important to realize they're looking at two things: symptomatic COVID-19. So did you get symptoms? And did the teenager get severe COVID-19? Did they end up in the hospital, ICU, ventilator, death? Okay. So notice the study did not look at asymptomatic infection. So we know that you can get infected with the virus and not manifest symptoms. Okay. So the study did not look at that. And thus it does not reveal much about asymptomatic spread from either vaccinated or unvaccinated youth. Okay, so we know that even if you don't manifest symptoms, you can still spread the virus, right? The study did not look at that. Okay, so you can't really get the study and say, well, if you get vaccinated, that you're gonna, limit transmission, stuff like that. Like it's hard to really report on that because they did not look at those who were asymptomatic, those who did not manifest symptoms. It was only those who manifested symptoms and beyond who really got tested for COVID and were really looked at. Okay. So what did they find? How many of the kids got symptomatic COVID-19? So, you know, coughing and fever and that type of thing. Okay. So first dose and second dose. Within that time period, 3 of the vaccinated kids got COVID-19 symptoms. Okay. 12 in the unvaccinated group got symptoms of COVID-19 and tested positive. So 3 versus 12. Now, after the second dose, 0 kids in the vaccinated group got symptoms of COVID-19. Okay. 16 in the non-vaccinated group got symptoms of COVID-19. So this is where they get the 100% effective from. You see that? 0 versus 16. So when you look at this, obviously this is 100% effective. So when you hear in the news, this is 100% effective, you have to understand what the numbers were. It was 0 versus 16. Okay, and they cut off the study. All right. So looking at this, obviously you can tell the numbers are not that big overall. You know, 16 out of 1100 is not that much, you know, overall. But nevertheless, you know, it is still 0 versus 16. So it's still 100% effective. Okay. How about severe COVID? I think this is important because I think most of us would agree that, you know, your teenager, it can deal with some symptoms of COVID, but we want to know, like, is my kid going to die? Is my kid going to end up in the ICU? Is my kid going to, you know, get breathing problems and, you know, some severe COVID, right? That's what we really are concerned about, right? I don't think most people are concerned about getting symptoms of COVID. You know, we're concerned about severe COVID. So, well, how did the vaccine group do compared to the non-vaccinated group? Okay. Between dose number 1 and dose number 2, nobody in either group got severe COVID. Okay. And lo and behold, even after the second dose, nobody got severe COVID. So no teenager in any group got severe COVID-19. Okay. How about death? Okay. Did anyone die in the study? Nobody in the vaccinated group died. And also nobody in the non-vaccinated group died. So basically no teenager died, no kids died in either group. And no kids in either group got severe COVID. Okay? This is a quote from the study itself. No severe COVID cases were reported in the study. No severe cases in the study. No mortality, so no death was reported in the clinical study. Okay. So basically, what it comes down to is this, that the vaccine prevented symptomatic COVID-19. Okay, there was no severe cases in either group. There was no death in either group. It was 0 versus 16 when it came to symptomatic COVID-19. All right. I hope that makes sense. I hope you're able to follow along here. Okay. So basically, my conclusion is this. Okay. There are a few things that really matter when it comes to COVID-19. Are you going to get infected? Are you going to give the virus to other people? Are you going to get sick? Are you going to get really sick? And are you going to die? Okay, I think we agree that these are the things that really matter. And when it comes down to the study, really, I think what we can say is that when kids get the vaccine, it lowers their risk of getting sick from COVID-19. Does it make sense? Okay, there was nobody that got severely sick. There's nobody that died. They didn't really look at transmission and they didn't really look at infection. Okay, so the vaccine does seem to help lower the risk of getting symptoms of COVID-19. Okay, so the finding is that the vaccine lowers the risk of mild COVID-19 symptoms. Okay. Now, the assumption that they're making is that because it lowered the risk of getting symptoms of COVID-19, that means that if the study went on longer, for example, that, basically the assumption is that it will lower the risk of transmission, it will lower the risk of severe symptoms and death. So basically, it's like if you extrapolate the data, then the assumption is that that less people will get severely sick, less people will die, and you lower the risk of transmission. Okay, so that's the assumption that you can make, but that's not what they found. The finding was that the vaccine lowered the risk of mild COVID-19 symptoms. All right. So I hope you're following along, and if you have questions, you could put them in the chat and we can clarify. Okay. So on the one hand, there are people who are saying, this vaccine is not effective. Okay, that's not true. Okay, the vaccine is effective, but effective for what? In the study, it showed that the vaccine is effective in lowering the risk of getting symptoms of COVID-19. That's what the study found. So to say that the vaccine is not effective is not true. It's false. Okay. On the other hand, the impression that we get is that this vaccine is like super effective, such that you're not gonna die. It's gonna lower the risk of severe COVID. The study found that it lowered the risk of transmission. Well, that's actually not true either. The study really did not find those things. Okay, the study found that the vaccine was effective at lowering the risk of symptomatic COVID-19. Okay, nobody got severe COVID, nobody died, and they really didn't look at transmission and infection. Okay, so you can make assumptions, obviously, right? But just when you look at just the study itself, the vaccine was indeed effective, but we have to understand what was it effective for. Okay. All right. Having said that, okay, now let's get some perspective. The COVID situation in Ontario among young people. And my apologies if you're from outside Ontario, but my assumption is that mainly the audience is from Ontario, Canada. Okay, so I don't know where you're from, but we're going to be focusing on Canada here, Ontario, Canada. Okay, so what is happening with COVID among young teenagers in Ontario? Okay, so you see here, this is a graph. Okay, and blue bar represents active cases right now. Orange represents resolved, so people got healed, they got COVID and they got better. Then gray represents death. And these are the age groups, 90, 80, 70, 60s, and onwards. Okay. So you see here, we're focusing on teenagers, obviously. In the under 20 age group, there was about, a total of like 85,000 cases of COVID since the pandemic started. Okay. Right now we have about 2,000 active cases. The vast majority of them have resolved. And you look here, 4 deaths. So since March 2020, so since March last year, you got like 85,000 people under 20, Ontarians under 20, so young Ontarians who got COVID-19, and there were 4 deaths. So you see here, the risk of death is very, very low. It's extremely low. And the resolved cases is very high, okay? And you compare that to other age groups, so like you could look at the 60s and the 70s, the 80s, and the 90-year-olds, and you can see clearly COVID-19 is very risky for those who are older. People who are younger, generally, I mean, it has to be it's you can't get around it. It's quite clear that young people, at least when it comes to like death from COVID, this is not a very serious issue when it comes to death from COVID-19. Okay, so if you look at the case fatality rate as a percentage, under 20, the risk of death if you get COVID, the case fatality rate is 0.005%. Okay, and you can see the risk of death, the case fatality rate is very, very low until you get, like in the 60s and beyond. Okay, so like if you're 90 years old, the risk of death is very high. The case fatality rate is super high. But, our teenagers, the risk of death is super, super low. Okay, so I think that's another perspective to keep in mind as well. Okay, so, should your teenager get it? Well, that's a decision that obviously you have to make, you and your teenager, right? Weighing the benefits and the risks. Okay, so you have to weigh the risks and the benefits. On the one hand, if you decide not to get vaccinated, there is still a risk of severe mortal COVID. There are young people who died. Like, there's 4 Ontario young people who died from COVID. So can young people die? Yes. Is that risk extremely low? Yes. But the risk is still there, right? You can still transmit to others, right? So if you get the disease, then you could transmit to others, right? So that is a factor as well. And of course, unfortunately, I believe that unfortunately there's gonna be stigma and social pressure. So it seems like there might be like stigma towards those who do not get vaccinated. And I think this is unfortunate, but nevertheless, I think it might be there. And with vaccine passports and things like that, they might start really limiting stuff that you can do if you don't get vaccinated. So that's something to consider as well. On the other hand, if you do decide to get vaccinated, okay, it's important to know that there is unknown safety data. Even the researchers themselves say there's unknown safety data. Okay, so that's something to keep in mind as well. All right. Okay, so just some quick final thoughts as we close off here. Why are young people less at risk for severe COVID? Okay, so first, their lungs are healthier. They're not exposed to environmental toxins and smoke and all that like older people. The longer you live your life, the more insult your lungs face from the environment and unhealthy behaviors and stuff like that. Young people, their lungs are generally healthier. So since COVID-19 is mainly for the most part, is a lung disease, healthier lungs means healthier outcomes, right? I mean, that makes sense, okay? Also, we talked about the ACE receptor. ACE receptor is what the virus uses to enter the cell. They found that young people generally have a lower levels of ACE receptors. So if you have lower levels of ACE receptors, then you're less likely to be infected, okay? Also, there's something called thymic involution. So basically, the thymus gland is really important for T cell maturation. Your T cells is an important part of your immune system, okay? So basically, as we get older, your thymus gland gets smaller and smaller and less effective. Okay, so young people, their thymus gland is still large and generally working well. So they're basically, the idea is like their immune systems are healthier than older people. Okay, so that could be also be a factor as well. I think it's very interesting. Okay. Also, young people, they have more immune cells. So you see grandpa here with a grandson. Grandpa is going to have less immune cells compared to his younger child, whether it be like particularly teenagers. All right, teenagers are going to have more immune cells than an elderly person, and if you have more immune cells, then it's more soldiers, right, to fight off infections. So that could be a reason why young people are less affected by COVID-19. Okay, there's also something called trained immunity. Okay, so here they say in this paper, another important factor is trained immunity, which involves epigenetic reprogramming of innate immune cells, including natural killer cells, after exposure to certain stimuli, including infections and vaccinations leading to memory. Okay, these trained cells react faster and more strongly to subsequent pathogen challenge, providing enhanced protection. Now, what does that mean? Well, when you face viruses, okay, your immune system mounts an attack and kills the virus. So the more infections you face, basically, the more training that your immune system gets. Okay, so that when it faces a virus like SARS coronavirus, so COVID-2, it has previous training in order to kill off the virus. So it's like kind of like like training for like in a fight, in like a boxing match. You get trained, and then when you face an opponent, the training pays off, right? So they're saying maybe that could play a role. Now, you know, um, adolescents, they're saying, that training of the immune system may help them face viruses. And of course, they got more of these guys, so more trained immune cells, better off facing, an attack, right? So that's kind of the idea, all right? Also, they're saying here, as coronavirus infections are common causes of upper respiratory tract infections in children, protective role of antibodies from other coronavirus infections against SARS-CoV-2 cannot be ruled out. So what they're saying here is that, there's a lot of different types of coronaviruses, right? Not just, this one, but there's a lot of different types, and they cause common cold. So it's very likely that most of us here got, common cold from coronaviruses, right? Well, when you face coronaviruses, your body creates antibodies. And basically what they're saying is that maybe those antibodies are helpful against SARS-CoV-2, the current coronavirus. So since kids get a lot of infection from coronavirus, maybe those antibodies may actually be helpful against SARS coronavirus 2. Okay? All right. Now, there's also something called antibody-mediated or dependent immune enhancement. Okay, so basically what that is when you get infected with a virus, you get antibodies, and these are called neutralizing antibodies. So basically, they neutralize the virus. But sometimes these antibodies are non-neutralizing. They actually don't neutralize the virus. So that when you face another coronavirus, the antibodies, instead of neutralizing the virus, they actually help the virus get into the cells. That kind of sucks, right? So these antibodies, which are meant to actually neutralize, they actually might be helping the virus actually get into the cells. So this is called antibody dependent or mediated immune enhancement. And this process occurs more often among older people. Hence why maybe older people are more at risk of severe COVID-19. Okay? Of course, young people have less chronic diseases, and chronic diseases like type 2 diabetes, obesity, heart disease, that kind of thing is linked with severe COVID-19. So obviously, like a teenager doesn't have these diseases, generally speaking, so they have lower risk of severe COVID. Okay, maybe they have higher vitamin D levels, higher melatonin levels. These things might play a role as well. Okay. Also, they have healthier blood vessels, and so they're less at risk of clotting. And we know that blood clotting is a major component of severe COVID-19. So since young people have healthier blood vessels, they're not going to get severe COVID-19. At least like some of the pathological features of severe COVID-19, like blood clots, right? It's important to note that, young people with asthma, cardiovascular diseases, cancer, autoimmune diseases, they may be at greater risk of severe COVID. And kids under 3 years old have a greater risk of severe COVID. Okay. All right. Now, you might be saying, well, my teen already got COVID, so should I get the vaccine? Okay. Well, if you look at the CDC, they're saying, yes, you should be vaccinated regardless of whether you already got COVID-19. That's because experts do not yet know how long you're protected from getting sick again after recovering from COVID-19. So should you get vaccinated? Well, they're saying you should get vaccinated even if you got COVID-19. Okay, so yeah, that's what they're saying. Okay, but if you look at the studies, what is the risk for reinfection? Okay, well, they've done studies and it seems like the risk for reinfection after you got infected once is very low. Now, this data is among mostly adults. Okay, I don't think there's much data on young people, so we're gonna have to do a little bit of extrapolation here, but at least let's take a look. Okay, so here you see this is from Qatar, the nation of Qatar, and the risk of reinfection was 0.73% of those who got first infection. Only 0.73% got reinfected after many months. Okay, and there were no deaths. Okay, this is from Austria. They looked at first wave and second wave. Okay, and the risk of reinfection was 0.27% of those who got first infection. Only 0.27% of them got reinfected. There was no COVID deaths. Okay, this is after 7 months follow-up. Okay, there's another study here. Only 8 out of 10,000 got reinfected after 8 months. And another study here, 0% reinfected. Okay, so basically it looks like the immune memory is very robust. That the risk of reinfection after COVID is still there. So you can be reinfected after you get the virus the first time, get sick the first time. But that risk is very low. And the risk of severe COVID is even lower. Okay. All right. And this is basically saying that, and we will just skip this for lack of time here. Okay. All right. Skip this. So we conclude that SARS-CoV-2 infection appears to result in protection against symptomatic infection. Okay. So the risk of reinfection is extremely low. So if you got infected with COVID-19 once, it seems like the risk is very low to get reinfected. The risk of severe COVID or death from COVID after reinfection is even lower, but it is still possible. Okay. Now, a very interesting study came out in Nature, and looking at how long does immune memory last after you get infected. Okay. Well, they're looking at bone marrow plasma cells. Okay, so what are bone marrow plasma cells? Well, when you get infected with a virus, your B cells, you get memory B cells, okay, and you get plasma cells. Okay, now memory B cells, they last a long time, but not as long as plasma cells. Okay, these are bone marrow plasma cells, and bone marrow plasma cells, they could last up to like years. So the question is, do we find that people who got infected with COVID-19, do they have these plasma B cells? Okay, and the answer is yes. All right. Our data provides strong evidence that SARS-CoV-2 infection in humans robustly establishes the two arms of humoral immune memory, long-lived B memory plasma cells and memory B cells. Okay, so basically what they're finding is that you do get bone marrow plasma cells, okay, bone marrow plasma cells, which can last, years. So it seems like, at least from preliminary data, that the immune memory, the adaptive immune system, is the immune memory is quite robust. Okay, perhaps providing protection for maybe even years, potentially. Okay. Okay. So, and it's also important to realize that, even though they're finding that those who get infected, those who get vaccinated can also be infected as well. So vaccines are not perfect either. Okay. So, those who get infected and those who get vaccinated both can get reinfected. Okay. Though the risk is very low in each case. Okay. Okay. Now, I want to just, time is running out here. So, but I just want to just share one other thought here. In the study, you got the unvaccinated kids, right? And they got sick. What happened to those kids? Okay, so those 16 kids who got symptomatic COVID, what happened to them? Okay, well, whether you get vaccinated or whether you get the virus just like naturally, you get infected, the end goal is the same. You mount an immune response, okay, so that and you kill the virus. The goal is to kill the virus and to form antibodies. Okay, so when you get COVID-19, the vaccine, the end goal is to create antibodies, and they found that indeed you do form antibodies to the spike protein. Okay, but how about the kids who didn't get vaccinated? Well, no one died; they all got better, right? So what happened to them? Well, the reality is we can pretty much assume that after they got infected, those 16 kids in the study, that they also got antibodies as well. And you see here, I put 2 antibodies, and that's because we know that natural immunity is indeed actually stronger and more robust than vaccine immunity. Okay, so the reality is that those kids who didn't get vaccinated and they got sick, the reality is that they probably got antibodies anyways. All right, so I think the question is really when you look at your teenager, you have to ask yourselves, can my teenager get sick and not die? And of course, that's really hard to predict, obviously, right? But I think that's really the question. If your teenager gets sick and they get better, then basically they're going to form antibodies and immune memory. That's what's going to happen. Okay, so whether you get the vaccine or not, the end goal is antibodies. And if you get sick and you get better, then you're going to get antibodies. You're going to get immune memory. And in fact, we know from many years of studying immunology that the more severe the sickness, usually that means actually the more robust the immune memory. Okay. Okay. I'll just skip this just for the sake of time. Okay. So so I just want to just end off here by just saying that I hope that I provided you with the information that you need to make a decision for your teenager and for yourself regarding the vaccine. Okay. Also, amidst all the discussion around COVID-19 and the pandemic, let's not forget that the most important thing is really to remember to be healthy, right? Because in the future, there's going to be other pandemics as well, and they believe that in the future, there's could be perhaps even something that's even worse coming along. So in that situation, we all need to be healthy. So whether you decide to get vaccinated or not, I think something that's been lost in the conversation is that we do need to be living healthy in the first place, and I think that's something to keep in mind as well. All right. So I went a little overtime here, Daniel, but if there's time for questions, maybe we can take some questions.
Thank you so much. We've been getting a lot of questions and comments here, which we expected. So we are a little bit over time. If you do have to go for some evening appointment, please do so. Thank you so much for joining us. If you do want to stick around for some Q&A, you can do that. We're not going to go too much over time. We always do try to really stick to the time here. So maybe just take a 5 to 10 minutes max, if that's okay. All right, so we'll take the questions, but first come, first serve basis. And Dr. Cho, if you just keep the answers short and to the point. Yeah, let me put the email. If you have follow-up questions, you could email us. Put the email in the chat and go into more detail. We'll connect with Dr. Cho. So We have a question from Elizabeth. Thank you, Elizabeth, for joining us. How come this vaccine was made as mRNA, unlike other vaccines?
I don't know. They decided to use technology. Why they chose to choose that technology, that's not really something that I'm privy to. I don't know.
Yeah. I heard that the BioNTech, the firm that built the vaccine with Pfizer, they're working on mRNA for cancer, I believe. Then when COVID happened, they switched and they focused on COVID.
Right.
And yeah, but yeah, and I think it's good to Dr. Cho, all the vaccines are not mRNA vaccines, right? It's just Moderna and Pfizer. Is that right?
That's correct.
Yeah.
That
yeah.
is.
Just to note that. All right, we have a question from Wilson. Thanks, Wilson. If mRNA is unstable and it disintegrates, how can vaccine remain effective?
I think the goal is that while it is still viable, that it'll stimulate the production of the spike protein. So, how long does does RNA last? I'm not exactly sure, but you know, while it is still there, the idea is that the body will start transcribing the protein, the spike protein, while it's still viable. Yeah.
Okay. Question from Andrew. Can you define safe a little more specifically? I think this was very early on in your presentation.
Right. Yeah, I mean, like I said in the early going when we discussed safety, you know, what I'm finding as I'm reading the study is that generally the risk of adverse events, at least within the study period, that's about 2 months after the second dose, that the risk is very, very low of adverse events. Okay, so I'm just saying within that time period, did anything really bad happen? And I think an honest look at the study would conclude that the answer is no. It's not saying that it's 100% safe. As we mentioned, the study itself, they reported, I think it was 4 kids in the vaccine group got serious, unsolicited adverse reactions. Whether that's from the vaccine itself, I don't think they really say. They couldn't really conclude. And what exactly happened, I don't think they really share in the study either. But when you look at just from a percentage standpoint, 4 out of 1,100, obviously the risk is quite low. However, I'm hesitant to say that this is 100% safe because obviously even the study researchers themselves, they say that beyond 2 months, so like long-term safety data, they don't have it, right? So, and of course we looked at, the case of myocarditis among those teenagers, right, in Israel. So yeah, that's what I have to say about safety. Yeah, it's probably not satisfying to everyone, but I think there's much to be learned about the safety. But within the study period, I think it's safe to say that there's a reasonable level of safety. The risk of adverse events is low, but beyond that, it's still to be. We still need to find out.
Okay. Question from Wilson. Isn't 1,000 youth too small a sample to measure safety and efficacy? Sample size is too small. It's a good question.
Yeah, that is a good question. You see, the myocarditis, where we looked at myocarditis, they say it's 1 out of approximately 5,000, right? 1 out of 5,000 males aged 16 to 24. That means that with a sample size of 1,100, it would not have been big enough to detect cases of myocarditis. Meaning that pretend the sample size was like maybe 30,000 young people, then perhaps they would have found cases of myocarditis, which maybe would make the study seem a little bit less, like it might raise a little bit more red flags from the study, in the study itself. So that is a really good point and really insightful observation. So yeah, there is that there is that too. I guess they probably had a harder time finding young people, like teenagers, to do a study. I mean, what teenager wants to be involved in a study, right? So obviously, it's expected. It's not surprising that the sample size would be smaller. And I think in an emergency situation, they probably desperately just try to find some results. So they probably just didn't have as many people compared to the adult study. So yeah, but that is definitely a valid point.
Yeah. I think it's important to take the study just as it is. Among the 1,000, these were the results.
Exactly. Yeah.
We need more study. And yeah. So.
But the good thing is though that they're continuing to track, and so we will see what happens, right? Because tons of young people right now are getting vaccinated. So let's see what happens, right?
Yeah. Okay. We have a question from Anna. Thanks, Anna, for joining us. Can you really trust them with these bias limited studies? Not sure exactly what you mean by bias, but maybe because it's from Pfizer and BioNTech themselves. So can we trust these guys,
Well, that's a really good point. And thank you, Anna, for sharing that. In nutrition, that's the kind of the area I'm focused on. In nutrition, we always say, like, if the industry funded the study, like for example, if the dairy industry funded the study, then we kind of like really skeptical, right? Or like if the meat industry funds a study, then we say like that's really, a little bit like we have to kind of question, right? Also, we say, you don't base conclusions off just one study. You want like multiple studies, right? So like you want multiple studies showing that flaxseed is good for you to say like, oh, flaxseed is good for you, right? So yes, obviously there's a weakness here. They're authorizing the use of the Pfizer vaccine based on one study. So the study that we looked at today is really literally the only study available, and it's from the company itself, right? So yeah, is there issues there? I think clearly there are, but I mean, what can you say? They're in an emergency situation. I think they want to just start vaccinating people quickly, so this is what they're doing. So
yeah. And also just to add, let's remember the point of this webinar was to kind of share with you what the study says, because the media is citing the study, making the vaccine, like you said, is 100% effective, but makes that sound like some super medicine that's gonna like save us. It's clearly that's not the case. Right? So we try to share with you a more balanced perspective to show that it's really not what the talking heads on TV are trying to make it out to be. If you look at the study, there's a lot of nuance. It's not some super thing.
correct.
So, yeah.
And we are bound by what information we have right now. So our goal today was to just share with you the actual data that is available. Yes,
That's right.
definitely, is there a lot of unknowns? Absolutely.
Yeah, the media isn't particularly good at reporting health stuff anyways. Anybody in public health knows that.
For sure.
So we have to look at the studies, and hopefully we try to do that. Another question from Anna here. It's very long here. Let me skip that. I'll come back after I shorten, make it more concise. Question from Sarah. Any info on how frequently young people are actually transmitting the virus to older folks? Your thoughts on that?
I don't have that information. My apologies. But I do believe though that it's mostly adult to adult transmission.
Yeah.
I don't think anyone's gonna say that young people are the main cause of transmission.
Yes.
Yeah.
That's my understanding as well.
Yeah.
So going back to Anna's question, I think in short, she's saying that she's sharing her saying teenagers do not need the vaccines. Teenagers can pass over the infection really easily. She's sharing her personal experience. She passed it over in 17 hours. Didn't even take several days to recover. So, question like, what's the point? Teenagers can pass it over very quick.
Yeah, that's totally true, and that's a fact. If you just look at the numbers, it's that is a fact that teenagers are not at serious risk of severe COVID-19, right? So, but there are 4 cases of young people who have died, so that is there too, albeit it's a very, very, very minute percentage of the cases. So I think we need to, each individual needs to weigh for themselves the pros and the cons and make a decision for themselves. Yeah.
Thanks, Anna. Question from Wilson. Isn't it a big assumption to assume vaccine prevents transmission and prevent death? Where is the evidence?
I think the idea is that the more severe your presentation is, the more likely you'll transmit it, you see. So basically the idea is like if we can get the number of people who are symptomatic down, then that will limit transmission. Because the idea is that if you're more symptomatic, then likely you're more could be able to transmit the virus. I think that's kind of the thinking there. So if the vaccine lowers the risk of symptomatic COVID, then they're extrapolating that'll probably lower the risk of transmission.
Okay.
Yeah.
But we can't conclude that from the study, though. Is that?
They did
like
not look at transmission. I think that's important. Right. The study did not look at transmission. They looked at symptomatic COVID and severe COVID. Okay.
Yeah. Okay. Okay. Question from Bina. Hi, Bina. If you already have an autoimmune condition with antibody positive, what are the chances of getting infected?
Antibody positive, as in COVID antibodies. Yeah. If it's COVID so if you got sick from COVID-19 already, the risk of reinfection is very low, and the chances that reinfection will be severe is even lower. It's less than 1% pretty much of risk of reinfection, and the risk of severe presentation is even lower than that. So that's what I have to say. Now with autoimmune diseases, I'm not exactly sure. Yeah.
Okay. Sorry. Is another question from Anna here. Isn't a vaccine supposed to prevent catching the infection? That's the basic definition of vaccine. If it doesn't even prevent you from getting the infection, then why would anyone take it?
No. So like basically a vaccine is not meant to prevent like the virus from getting into your lungs, right? The point of a vaccine is to help you mount an immune response quicker and more effectively to a pathogen. That's the point of a vaccine. No vaccine or any lifestyle really prevents you from the virus from getting into your body, you see. But the question is what happens once it gets into your body, right? That's the question. And so the idea is that a vaccine trains your immune system to mount a response more effectively once it faces that pathogen, you see. So you could do that through a vaccine, or you can do that through natural immunity, as in you face the virus once, so then your immune system is primed already and trained, so that when it faces that virus again, it's already learned how to fight it, so it fights it better. Okay, so that's natural immunity, and that could also happen with the vaccine as well.
Okay, that's good. Just quickly try to close off here. Question from Jackie: why is natural immunity stronger than vaccine immunity? How does one get natural immunity? How does one get natural immunity?
Okay, so natural immunity is like what I described. Okay, natural immunity is basically you face the virus or pathogen head on. So like you get infected with the SARS-CoV-2 virus, you confront that virus, your immune system confronts that virus, and it successfully overcomes that virus. When it does that, your immune system creates T cells and B cells. And B cells are memory B cells, which now are able to produce antibodies against that pathogen. That's natural immunity. Okay, you face the virus head on and you successfully defeated it, and now you get memory. Okay, that's natural immunity. Now, they're finding that from previous experience with other infections, that generally speaking, natural immunity is stronger than vaccine immunity, and all the details of why that's the case, I'm not too aware of that. But the reality is that this is what they found, that natural immunity is more robust than vaccine immunity. Okay, and in fact, they find that if you get more severe presentation, like more severe case of an infection, and you overcome it, the more severe it is, actually, the stronger the natural immunity. So yeah.
Okay.
I think the question is, can someone face the virus head on and successfully defeat it? You see? So what we're finding is that, like, in 90-year-olds, for example, the risk is high that they will not be able to defeat the virus when they face it head on, right? So in that case, like, you could see where a vaccine might be helpful. For teenagers, though, it seems like the vast majority of teenagers can face the virus head on, and their immune system is strong enough to basically easily defeat this virus.
Yeah. Okay. Hey, we have a good question from Michael here. What are your thoughts on long COVID? Long COVID. It's a really good question. Yeah.
It is. I believe that it's about, I think, 10% of people who got COVID-19, they get long COVID. And basically, for those of you who don't know what we're talking about here, long COVID, they call it long haulers. Basically, these are people who, even though like they like even months after getting the infection, they still manifesting symptoms. And we actually haven't I actually have patients who I believe they do have long COVID. They've got infected with COVID, and they're getting like headache, they're getting fatigued, and a little bit of shortness of breath, that type of thing. So the symptoms seem to be lingering. Many of those people actually, they get better though. So long COVID, it does seem to affect, certain percentages of people. I believe it's about 10%, but many of them actually do get better, though some of it actually still seems to persist even after like 7 months, which is kind of really sucky. So yeah, definitely the risk of long COVID is there.
Yeah. Okay.
And they're still learning more about it, right?
Yep. Okay, we have another comment from Anna. Anna's keeping us on our toes here a little bit. If you have a poor quality or quantity of sleep, even the response to vaccine is ineffective. You don't get any protection. You should know that from the sleep module from ACLM. So if you're a lifestyle medicine doctor, so the answer is in the body, in a healthy lifestyle, not in the vaccine.
Right. Yeah, that's a great point. The head of vaccine research at Mayo Clinic, in 2018, he released a paper where he says that vaccines are like seatbelts. They only work properly when the conditions are they work optimally when the conditions are optimal, meaning that an optimally effective vaccine, a vaccine is most efficacious when the immune system is working is in tip-top shape. So I think this is, Anna, I think you make a great point. I think this is a part of the conversation that's been lost, that vaccine failure is very real, especially among seniors. I believe the numbers are up to like 30% of seniors, they get vaccine failure, meaning that vaccines that they get do not work. Now, we don't know the numbers for this particular vaccine, but just generally from many years of experience with vaccines, they're finding that among seniors, vaccine failure is a very real phenomenon. And that's because you need the immune system to mount a response to the vaccine to even make it beneficial, right? The vaccine is not a Pac-Man that goes around killing viruses. The vaccine is passive. You need your immune system to mount a response to the vaccine to even get anything going. So that means that the immune system needs to be in tip-top shape for you to really get the most benefit from the vaccine itself, right? So when you have a population like many of us in Canada whose immune systems are not working well, then the risk of vaccine failure is very real. And I think this is a part of the conversation that has been lost, and which is that regardless of whether you get the vaccine or not, your immune system needs to be working well. And the way you do that is through a healthy lifestyle. So like Anna said, like sleep, nutrition, exercise, that type of thing. And we know we did a presentation before on it, where we talked about these things. So I think, yeah, the message is clear. We do need to be living healthy regardless of whether you choose to get the vaccine or not, right? I don't think the vaccine is a replacement for, yeah, the vaccine is not a replacement for a healthy lifestyle. Healthy lifestyle is the foundation for everything. So that's an excellent point, Anna, and I appreciate you bringing that up.
Okay. Yeah, we've gone really over here. So let's just take this last question. I think it's a good one to end off on. From Mickerson, thank you for joining us. Where can we follow the evolution of these stats? So like new data as they come rolling in, where can we where can normal people like us just track that?
Yeah, that's a good question. I'm getting my data from the peer-reviewed literature, so PubMed, and that's where they actually have like scientific papers. Now, I understand that most of you are probably not interested in reading a bunch of scientific papers, but that's really where I'm getting my information from. For you all, I don't know, where can you stay on top of things? I don't know, Dan, I don't know. Do you have any ideas? I'm just getting it from the peer-reviewed literature. That's where I'm mainly getting my information from.
Yeah, like for instance, like some of these like the New England Journal of Medicine, I think they had a very like easy to understand videos and stuff to help you understand the studies that come out. So I think, I don't know, from my personal perspective, if you hear a study that the media is citing, like go to it on PubMed, go to like the journal website. They usually have like these like helpful guides just to help you understand what they're actually saying. Look at the numbers and just kind of put them in perspective, not just take what the media says at face value. I don't know. But science is I think that's one of the enduring problems of science is it's not very accessible to many people.
That's right.
Unfortunately.
Yeah. Unfortunately for many of you, you're gonna have to depend on the media, and you're just gonna hope that they're reporting things correctly. They often don't, but I mean, unless you're willing to go to the actual papers, I don't know what else is really left for you to depend on. Yeah.
Or maybe find other health experts that you trust.
Right. Yeah.
Different perspectives as well. There's not just the same people. Yeah. So, okay, well, we've gone over. So thank you everyone for your patience. If you couldn't get to your questions, we apologize. Please send them by email to us and you can connect with Dr. Cho. We want to thank the Downsview Seventh Adventist Church for hosting this with us. So thank you, Sherelle. And we hope that you've learned something that will be helpful to you. And we really encourage you to know and do research for yourself. And we want to invite you to our next one is next Sunday, our next online event. It's with Jack Middleton. He's going to share with us how to make plant-based eating tasty. So a lot of people, when you go plant-based, people just think it's just a bunch of salad and it doesn't taste good. That nothing can be further from the truth. Plant-based eating can be really good. And we want you to come and learn that. So we want you to join us next Sunday at 4 o'clock. You can sign up at lifestylemed.org/online and hope you can join us. So thank you, everyone. Thank you, Dr. Cho, and we hope you have a wonderful rest of the evening. And stay safe and stay healthy. Remember, your lifestyle is the best medicine. So thank you, everyone. God bless.